I'm Albina.
I'm Kim.
I'm Victoria.
And my name is Sylvia. Our presentation is on supportive care during labor. It includes physical comforting measures, emotional support information, and instructions. We will show many practical techniques that nurses can use to support women during the different phases of labor. These interventions are intended to ease a woman's discomfort, anxiety, loneliness, or exhaustion.
When the mother is free to move and change positions, she's more comfortable and her labor even may speed up. Encourage her to try a change in position or of movement every half hour or so if she's feeling restless, discouraged, is in a lot of pain, or if labor has slowed down. Positions she can try include standing, walking, sitting, semi-reclining, squatting, kneeling, lying on her side, getting on her hands and knees, or leaning on her partner or a birth ball. We will now demonstrate several different position changes and comfort measures that may make a positive difference for the laboring mom. The slow dancing position. This causes changes in the pelvic joints that can encourage the rotation and descent of the baby. The mother embraces her partner around the neck and rests her head on the partner's chest or shoulder. The partner's arms are around the mother's trunk. Being embraced by a loved one increases the mother's sense of well-being. The pressure from the partner's hands helps to relieve back pain. They sway to the music, breathing in the same rhythm, which adds comfort. The lunge position. This position can be done in a standing position or a kneeling position. In the standing position, the mother places one foot on the seat of a chair. Bending her raised knee and hip, she lunges sideways repeatedly during a contraction. This position widens the side of the pelvis toward which she lunges. It also encourages the rotation of a baby that is in the occiput posterior position. The supported squat. In this position, the partner holds the mother under the arms as she leans with her back against her partner and bears all her weight during a contraction. This position helps lengthen the mother's trunk, allowing more room for the baby to maneuver into position. With the use of gravity, it enhances pelvic joint mobility, allowing the baby to push the pelvic bones as needed to descend. Sitting, leaning on a table tray. This is a position that is particularly helpful for back labor. It relieves backache and makes it easy for the partner to give a back rub. The side lying position with leg support gives the mother some rest by allowing relaxation between pushing efforts. This position is safer than standing or using the hands and knees position if pain medications are used. It may promote the progress of labor when alternated with walking, or it can slow a very rapid second stage. It helps lower elevated blood pressure, makes interventions easy to perform, and takes the pressure off of hemorrhoids. The open knee chest position. The mother gets on her hands, lowers her chest so her buttocks are higher than her chest. This position uses gravity to promote movement of the baby's head or buttocks out of the pelvis and reduces pressure on the cervix, which may be desirable if the cord is prolapsed, the cervix is swollen, or the baby is in the OP position. Spending 30 to 45 minutes in this position is sometimes recommended in early labor, when the baby is in the OP position and contractions are frequent, very painful, and accompanied by back pain with no progress in dilation. The hands and knees position. This position helps relieve backache by allowing for pelvic rocking and other body movements. It assists in the rotation of a baby that is in an OP position. It makes a vaginal exam possible and takes the pressure off hemorrhoids. The double hip squeeze is used to provide counter pressure during a contraction. The mother stands or kneels and leans forward onto a bed, birth ball, or gets on her hands and knees. From behind, the partner presses on both sides of her buttocks with the palms of her hands, pushing toward the center, pressing her hips together. Many moms in labor experience low back pain or pressure. As the baby settles lower into the pelvis, the head puts more pressure on the sacrum. The hip squeeze pushes the pelvis back into a relaxed position, relieving the pressure of the stretch. Kneeling over the birth ball provides the same benefits as the hands and knees position, but this position is more comfortable. It relieves back pain or pressure, helps the rotation of an OP baby, and may help to improve a baby's heart rate. Standing and swaying with the birth ball gives many of the same advantages of kneeling over the ball. However, this position also uses gravity to help the baby descend, and it makes it easier for the partner to give a back rub. If the mother is standing by the bed, this position can be used with an electronic fetal monitor. Sitting on a birth ball and swaying during a contraction helps to relax the mom's trunk and pelvic floor. Other comfort measures are also helpful during labor, such as music, massage, hot or cold packs, or a bath or shower. Many women can relax and focus better if their favorite music is being played during labor. In fact, familiar and well-loved music has been found to raise levels of endorphins, our body's own pain-relieving substances. Massage and touch conveys a caring and comforting message. The mother may appreciate gently rubbing or a more formal massage. Hot or cold packs are very helpful if the woman has back pain or pressure. Immersion in deep water or a warm shower is one of the safest and most effective forms of pain relief in labor.
A long-term study of women's memories of their first childbirths found that 15 to 20 years later, women had vivid memories of specific words and actions of the nurses. Those who remembered their nurses as kind, respectful, and supportive expressed the greatest satisfaction with their births. A woman never forgets her experience in giving birth, and she will never forget you and how you helped her through the process.